What's going on? We're back at it again with another episode of Combos with Dr. Andy with your boy James and Dr. Andy. Today we're going to talk about spinal health and what it means, what it doesn't mean, what you should look for, what you should stay away from, and potentially breaking down a little bit of the vocabulary that's thrown around to do with your spine that's maybe inaccurate, but was given to you by somebody so you could understand the concept of your spine. So you can go ahead and kick us off, Andy, and all things spinal health. Here we go.
All things spinal health. Yeah. Yeah, man. So I want to first, you had mentioned you had mentioned that people use certain phrases to kind of describe spinal health. So I'll get to that in a minute. So for me, spinal health it's a umbrella term, right? It doesn't necessarily mean one thing, and it can mean multiple things to one person. But at least in my office and kind of how I work and perceive with what I do in my profession of structural correction and chiropractic. So I do a lot of my basis off of x-rays. And so like objective measurements of their spine. So when I use the term spinal health with, say, some of my patients, it may mean something different than maybe another practitioner, right? Doesn't even necessarily have to be a chiropractor, but maybe a PT or an orthopedic surgeon, you name it. So this is just based on my perception with the technique that I used. So in my office with the other Dr. Brian and myself, so we deal a lot with structure. So first and foremost, when you're looking at somebody, right, whether it be through an x-ray or just if they're standing in front of you, okay, from the front or from the back, their spine should look nice and vertical, nice and straight, okay? No deviations from side to side, left or right in this case. If you turn them to the side, so you're looking either at their right side or their left side, okay? You should see some curves. So I drew a little diagram and I'll kind of dissect it a little bit just in case if you're not watching this on YouTube, okay? You can kind of walk through it, kind of just listening. So I kind of made this little, can you see that, James?
Yeah.
Mm-hmm. Nice. Okay. So this is my little stick figure and I wrote front in the front and I wrote back in the back for you guys. The top circle is the head. And then I drew a little squiggly line for their spine, and then a little triangle for their hips, and then their legs. So at the very top, okay, their neck should have a little bit of like a C shape to it, okay, and that's called the lordosis. In their mid back, okay, so think in between your shoulder blades, think where all your ribs are and attach, right, and wrap around your chest. That part of your spine should kind of be rounded over, like a very minimal Hunchback of Notre Dame. Very minimal Hunchback of Notre Dame back, okay? And then the low back is going to look similar to your neck, okay? Where it's going to start to maybe indent in a little bit. So think about like somebody like a cheerleader who kind of sticks their butt out a little bit and their belly kind of goes out and their spine kind of dips inward in their back. That's called lordosis. You should have a little bit of that. And then their tailbone should be similar to their mid back, okay? Think of like, where their butt is, okay? That should have a little bit of what's rounding like their upper back where the ribs are. So the neck and the low back, scientifically, anatomically, those curves are called lordotic, okay? You don't need to remember that, okay? And then the mid back where your ribs are, and then your tailbone, okay, which is where your glutes are, your butt, right? That should have a kyphotic curve. So measurement wise, and again, this is just for, my knowledge, you don't necessarily have to know this to go about your day and your life. But these curves roughly stay normal between 35 degrees to 45 degrees, okay? So with your kyphosis in the mid-back where your ribs are being a little bit less, somewhere around like 25, 28, maybe 32, upwards of 35. But again, those numbers are for me. But essentially, so very, very bird's eye view, okay? James, you asked about my perception of spinal health, is I'm looking for that alignment superficially, okay? So if
define superficially for people that don't know what that means.
So not going into like the structure of their actual and makeup of their actual bone, like the density, whether or not they've had degeneration, arthritis in there, any kind of pathology, right? Not going into like, the integrity of their discs, all that stuff. Or even subluxation, which is just the misaligned vertebrae that affects the nervous system. That's going a little bit too deep from this conversation, but That's what I mean superficially. Like if I just look at somebody, I don't know them at all, right? And I'm just looking at their posture. That's what I'm looking for. I know that some people come in, and I'll let you kind of chime in here too, with maybe some other terms that you might have heard. A lot of people will come in to our office, right? And they'll verbalize to me whether or not they've been at another chiropractic office or maybe another healthcare professional's office, right? Or they may have just like heard this from somebody and they assume that they have it, so they just voice it. I've heard of, oh, hey, doc, my hips are out of alignment, or my disc is slipped, or, my hips are unbalanced. I'm unlevel. My right leg is short, my right foot is short, my left foot is long, and then you coined this, or not coined this, but you mentioned to me this before you hopped on, or, popped a few ribs out of place, right? I kind of want to, touch on each one of those and just kind of, say that I've been, I can be accused of using some of those terms, right, with patients, just because it's, again, I don't necessarily need to go into a 15-minute conversation, right, about explaining everything that's going on in their body. Okay. If I can take care of it on the table, if they want to know, I'll definitely go into more explanation. But most of the time, people don't really want to, sit there and be told like, hey, everything's wrong with my spine. Just fix me, doc. Right. So I'm more than happy to, but, unless somebody asks, right, and it's appropriate, I don't necessarily deem that, necessary. So first and foremost, are there any other terms that you want to throw out there that you've heard or that have been tossed out?
I mean, I popped a, and you mentioned a couple of these. I slipped a rib, I popped a rib.
Yeah.
My pelvis slid, my hip slid, or like someone will be like, genetically one of my legs is longer. Like the docs always told me my legs, one leg, like my right leg is longer, so I strike more. So, I have more problems on my right side, or, I think that outside of those, you kind of mentioned just about everything else that gets said on a day-to-day basis. And I think something to make note of here is that when those terms are said, oftentimes, maybe they've been said by a practitioner in or out of chiropractic. Maybe they haven't. But I think that what a lot of times people are grasping at is a conceptual understanding of what's happening with their body.
Yeah.
Right?
Yeah.
Or a desire to understand, but maybe using wrong terminology like people do when you walk them through a Bulgarian split squat or this or that. You walk them through an anterior or posterior pelvic tilt. When you walk them through things and you use words that are not in their vernacular, right? That are not in their day-to-day usage. They remember statements, or they remember some sort of combination of words there to try to be able to communicate it to other people to show them that they're not crazy. They're like, no, what I'm doing is working because doc said da 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 da.
Yeah, it's got a fancy, whether or not it's a simple term like unbalanced, right, or slipped, or it's an actual like degenerated joint, right? DJD, degenerative joint disease, a fancy explanation of what they have going on to validate it. Yeah, I mean, as you were talking, I just remembered that I had a conversation with a patient the other day where he had what was called an anterior segment, right? Anterior meaning forward or front. So one of his segments had moved minimally, a little bit more forward, right? And that's a term in chiropractic that's used to kind of isolate and designate, what had happened to one segment. Okay, because
segment of his spine, is that what you're saying?
Yeah, segment of his spine, right?
So essentially, like it's in a line, and then one is more forward.
Yes.
Okay.
Yep. Yeah, and we're not talking if these were two vertebrae, right? Okay, and like my knuckles are the front. It's not. We're not talking like it's totally off the spine, right? We're talking like millimeters, even maybe half a millimeter, right? So I think, and so it's gonna determine whether I adjust that patient from the back or from his front side. Okay, where I lay him on his stomach or I lay him on his back to adjust him. So, but he was curious about it because he'd never heard that before. So I just broke that down for him. Hey, it just changes up the way that I need to adjust you. That's all, right? There's nothing wrong with you. So, but I think too, one thing I want to touch on as well, James, before I kind of go into each of those like words and kind of break those down that we just went over, is people when they come in and get adjusted, So at our office, right, we don't recommend that people just come every time that they're feeling a symptom, right? Because you're not really fixing the problem. You're just you're masking the symptom. So sometimes they'll come in and they'll kind of think that, oh, am I out of alignment? Like, it's not holding. We're not, you're not meant to be super glued into one position, right? When we get into, knock on wood, hopefully nobody, listening to this ever gets in a car wreck, right? Or, for those people that watch football or even play football, right? Some of those collisions that you see, there's a reason why people aren't just getting hit and then dying on the spot. We're pretty durable. People get in massive, wicked car accidents, and albeit, I'm not advocating for people to get into accidents, but they live through it. They're unfortunate when they do happen, but we're durable species. So when you walk into an office to get adjusted, and whether it's your first time or whether it's your 200th time, right? It's not a matter of, oh my gosh, my bones aren't holding where they should. No, you're meant to move. You sit in awkward positions, you walk a lot, you stand. We're in non-ergonomical settings. We're not meant to be in perfect posture 24/7, 365. So a lot of times what I have found and what I believe, more so with chiropractic to do for people is it changes your nervous system. It changes your neurology. So if you're somebody who's like super tight, right? Okay. And that can be from, if you just go and, you did a heavy workout that involved that certain muscle group of the body. Yeah. Right. Or if you're just incredibly stressed and that's just where you hold all your issues in that particular tissue. And I know that rhymed. So when you get adjusted, one thing that I notice, right, and that I explain to patients too, right, when this happens, is I see a change in just their body tone. And what I mean by tone is like they're just state of tension. So I don't have to spend hours of massage on them. And I'm not knocking massage. I was a former massage therapist. I think it's amazing. Everybody should get a massage if they can, afford it, right? It's a great modality. But what I see is that I can tap into the nervous system and change tone in tissues just with the adjustment. Because when somebody walks in and they lay it down on the table, and one of the things that I do is I check their leg length. So I check their feet and I see if one leg is longer than the other. That doesn't mean that they were born with a short leg or they were born with a longer leg. That does happen, right? Some people's bones do grow at different lengths. That does happen, right? Some people might have had a trauma, such as a broken bone, and they had damage, right, to the cartilage that ceased growing, or they maybe have a pathology that caused them to have abnormal growth, too little or too much. But for the most part, people are walking around with pretty symmetrical limbs. Okay. So when they come in, and most people, when you check them, right, initially, and most chiropractors will probably agree with this, that their feet are usually unbalanced if they've gone about and lived life. That's normal. So when I adjust them, whatever their body needs to get adjusted, right? Let's say it is their pelvis. Let's say it is their, when I say pelvis, I mean like their hips, right? And their SI joints, their tailbone, or like their low back, right? Mid back, neck, whatever it is. I'm checking, when I recheck them, I'm checking their nervous system to see if the nervous system is kind of retonified or rebalanced, right? Certain muscles. Because if you're tight in your calf, if you're tight in your hamstring, if you're tight in your glutes, if you're tight in your quads, if you're tight in your abdominals, you name it, right? That's going to alter your place and space of your skeleton. One leg will be pulled up, one leg will be relaxed down. So I'm checking to see if that levels out through the brain, through the nervous system. Okay. I'm not taking somebody's leg and I'm yanking it and making it longer. I can do that if that, adjustment is needed. And I'll check for certain things to make sure that's the case. So spinal health has a lot more to do than just like looking at curves, right? That's a very bird's eye view of it. Then you start getting into, is my spine, is it in alignment? I get that a lot. First things first, I make sure that, hey, that's why we take x-rays. We want to see if those curves are there. We want to see if they're straight from the front and back. We want to see if they're curved from the side. Okay. If they're not, we know that we can do a better job of having their spine in better health if we get that aligned, and we, adjust accordingly, and we set them up on certain modalities such as traction to get that objective. The term slipped, you had mentioned that earlier, and I think I mentioned that earlier. That only really applies if you slip on something with your foot. It doesn't really apply to joints, unless, yeah. I mean, I've never heard that in a professional sense, being like, oh, your disc has slipped, or your hip has slipped, or your pelvis has slipped. I've never maybe I'm out of out of practice on that, but I've never heard that in a professional report. I wouldn't know what to think of that if I read that on a report, such as an MRI or a CT or an X-ray. But I think it's easy when people think, I hear that a lot with like, oh, my disc slipped. And I think what they're referring to is if my hands are two vertebrae in my spine and the space between my hands is the disc and my vertebrae moves in relation to the other vertebrae, either whether it be below it or above it, what they usually mean is that there's now integrity that's been damaged to that disc, that vertebrae is now in a different position than what it normally was. Than it normally was. It doesn't mean that your vertebrae is now like slipping and sliding like it's on ice skates in your spine every time you move. That's not the case. There are so many tissues in place that make your spine stable. So the term slipped, I think, should be just totally removed. That should never be used to be describing whatever's going on in the human body. Unbalanced is a term that I think gets overused, and I'm guilty of this. It's just an easy way to say like, oh yeah, hey, you're unbalanced. Like, let's just get you balanced out and you're good, kind of thing, right? But what it really means is that you don't need to necessarily work on your balance. It just means that, hey, right, your brain might be firing too much, energy into this muscle, right, or this group of tissues over this one. So you're just a little bit, tighter or more tone on one side, and it's causing your spine, your pelvis, whatever, to be misaligned. Unlevel, same thing, right? It's just a term used to maybe describe, hey, right to left, okay, top to bottom, you're a little bit unlevel. That has more to maybe do, again, with like balance of the brain, the nervous system, trying to make sure that your eyes are level, okay? Because if your spine is all crooked, you're definitely unlevel, right? But I think it's a term that I think people just use as like, oh, I'm unlevel. No. It's just, hey, we're working on your curves. As far as the short and the long leg, those are just terms that at least I use as just a way to go about my processing and my diagnosis. Oh, hey, your right foot is short when you're laying face down. I bend your knees, it stays short. That's going to give me a different idea of where to adjust versus, your foot is short when you're face down. I bring your knees up and your right foot goes a little bit longer. That's going to give me two different areas to adjust. It doesn't mean that you're walking around with one foot that's like longer than your left. Or it doesn't mean that, like you said, James, you're not born with a longer leg than the other one. Like I said, you can be, but just because somebody, a chiropractor or a healthcare professional, says, oh, your right foot is short, oh, your left leg is long, in my mind, unless they're congenitally or AKA born with a longer leg, or they developed a longer leg or whatever from a trauma, you just make sure that you explain that to your patient that, hey, yep, it just showed up a little bit longer. Let's get you adjusted. Let's recheck you and make sure you're balanced out. Right. So now onto the rib, because that's kind of a hot topic. I know a lot of people use this like, oh, I got a couple of ribs popped out, or I think I popped a rib out. So first off, ribs, if you have one that's been what's called subluxated or just misaligned in the joint that it usually is housed in, it feels like a knife. It's hard to breathe, hard to move, hard to lay down. You can't get comfortable. I don't know if you've had these before, James. It feels like somebody's taking a pen and just stabbing you. So that's usually a quintessential rib that's quote unquote popped out, right? Or the better term is, subluxated. So I'm going to use my hands as kind of this analogy.
Do you have a fly in your office?
I do. Yeah. This little,
trying to get away from.
You've noticed that. Yeah.
Whoa.
There's this little gnat that's just like flying around. Yeah. So if you see me like swatting at something, that's what I'm going after.
He doesn't have Tourette's, guys. Don't worry.
So I'm going to use my hands and I'll try to describe this best I can, right? For those of you guys that are just listening, not watching. But so if my knuckles here are slots in my vertebrae, so my vertebrae are the bones of my spine, you have ribs that come in and they kind of sit right in these little grooves on your vertebrae. Okay. They're not very deep because you're meant to breathe and you're meant to move and bend and twist and all that, extend backwards, flex forward. So these ribs need to be pretty mobile, right? So when somebody says they popped out of place, they're not totally disconnected. Okay. Okay. That can happen in like a very severe trauma. And that's emergency room. We're talking surgery right away. But what usually happens is you just kind of increase the space minimally between those two bones. Okay. Or it might have gone, one might have gone up a little bit. The other one might have gone down a little bit. So just a little bit of movement. Okay. So anywhere in the body where there's space created, where there wasn't space before, it's going to fill itself with fluid. And that fluid is primarily going to be blood, right? Blood and lymph. Lymph is like the watery substance of the body. And then cells, which then go in there to heal whatever just was there now, space that wasn't there before. So that's called inflammation. And it's very painful. So it's incredibly painful because you have a lot of nerves wrapped around that tissue. Rightfully so. You're breathing 25,000 times a day on average, right? Maybe more if you hit the assault bike, right, for a long time. But that's a lot of movement. So like you need a lot of nerves to like supply those muscles with a lot of, to do and a lot of blood. So yeah, when those ribs pop out, they usually just create a little bit extra room, okay, between that bone and where that rib comes in to meet it. And it's really shallow. It's really shallow. Just touch your fingertips together, right? And that's pretty much what that feels like. It's very just surface level. So yeah, that's primarily what a popped out rib is just a very, very minimal movement of that rib off the vertebrae.
Yeah,
Okay?
that shit's happened to me front squatting.
Yeah.
Yeah,
Yeah.
on just one side too.
Yeah.
And it hurt like shit. Same
And
thing with wrestling.
And I'll say this too. Yeah. So ribs have a propensity once you have them move a little bit too much, so they subluxate, just kind of deviate where their orientation usually is set up, it's likely to happen again it's just like anything else, unless you set it back in place and then continually just have it relearn, because the tissue, once it expands, it stays stretched out unless you do something to force it to shorten. Okay. So we remember was it putty, like Play-Doh or putty from back in like when we were youngsters, right? Like gushy kind of, you pushed on it, made a fart sound, right? Mm-hmm. So if you put a little weight on that, right? If you put a little putty on a table and then you put a little weight on top of it and just let it sit there for a while, that putty would sink, right, with the weight. Okay. And that's called creep. You're just changing the alignment, or that you're changing the position of the tissue. So same thing with ligaments, which attach bone to bone, right? Is when ribs kind of subluxate away from the vertebral body, okay, or the spine, right? Those ligaments and the capsule, which is kind of like the tissue that surrounds it, stretches a little bit. And so if that stays like that, or you constantly, crack your own back, okay, you loosen that tissue up. And so the propensity for that to re-pop out of place, right, especially on one side over the other, right, occurs more and more and more and more and more. Then sequela, long-term consequence could be like, oh, breathing's harder, right? Or I can't cough quite like I used to. I can't get mucus up like I used to, because what happens is when those tissues expand, those non-volitional tissues expand, then your muscles end up getting tighter to make up for that instability. And so you can't take as deep a breath in, right? Stuff gets stiffer. And then you might even get, you might succumb to becoming sicker more times, because the less you can move your lungs, right, the more fluid stays static in them, right? Just like anything else, static fluid breeds bacteria, right, and infection. So, and again, that doesn't mean you pop a rib out, oh my gosh, you're going to get pneumonia, right? That does not mean that you're going to end up with that. It's not a 1-to-1. Okay. But
don't scare the people out here.
Yeah. No, that's just one of those things where it's like, hey, you let something kind of, sit and fester like that. Yeah, that could happen. But as far as the rib popping out of place, no, it is not popping. It's totally separate. It's just a little movement, right? Now you have more movement where you shouldn't, gets inflamed, hurts like hell. So a chiropractic adjustment, super easy to pop that back, adjust that back into place, right? You just have to figure out where it's gone, up, down, laterally, sometimes medially. That's kind of hard, but towards the spine. But yeah.
Well, I think that it's something for people to understand that that spine health looks like more than just hopping on the table and your chiropractor saying that you need to get adjusted once a week. It's also more than just you looking at anatomy on a 2D drawing in a piece of and on a piece of paper inside of a book and think that you're going to understand it just like that. So If we could, let's recap as far as spine health. I know you said kyphotic, and you said lordosis and kyphosis, but talk to me about if someone is looking so that people can understand this. I thought about this while you were talking. If you're to say, hey, towards your, like from your fingers, the end of your fingers, right, are going to be the front of your body. The back of your hand is going to be your back, right? If you're saying the curvature is forward, right, like more Hunchback of Notre Dame, so a C pointing forward, what is that?
When you say, what do you mean? What is that?
So your body's going out of your fingers. Okay. So when you have curvature in your spine that looks like this, right? The C is forward. That is what?
That's kyphosis.
Okay. And so then when it's turned the other way, right, and your spine is kind of bending, like like your fingers are going through your back, right, backwards. That's what? That's
lordosis.
Okay. So for people trying to understand, like, okay, my spine should really, I know that you showed a little diagram there, but for people to understand that, like, your back there will be from the top of your head, from the crown of your head down to your feet, you will have curvature multiple direction, like both ways down your spine. It's not going to be like, hey, you're just rounded or you're just going the other way.
Yeah. Yep. So exactly. So your neck and your low back, right? So the area above your butt, those curves are going to be the same. They're going to be both lordotic, right? Which you just kind of illuminated beautifully there with the hand gesture. The mid back is going to be the opposite of that. So the mid back is going to look like a turtle shell, right, on X-ray. But it does not mean that your whole spine, from, if my fingertip was my head and my palm here, the base of it was my butt, it's not this giant turtle shell. Yeah, the mid back is. Your neck goes the opposite way, and then your low back goes the opposite way. Yes. Yep.
Yeah, I think that's good to understand for people. So you won't look like an Instagram model, right, with your butt against the wall and your face at the front desk.
No.
You will not look like that. You will also not look like a turtle. And I guess turtle obviously can happen with people that are younger. Like, your spine health can be that bad, I guess you could say. I think that's a fair thing to say, even younger than like 80 years old. But a lot of times when I think turtle shell, I think grandmas, grandpas that for years and years and years have just let those shoulders roll forward, and they're on a cane. Now they're bending over and they're never walking upright. And that curvature of the spine is ridiculous.
Yeah. Yep. And again, too, with that, too, we see a lot of different curves. So you, from the side, you definitely don't want straight. Okay. You do not want straight from the side. You want that from the front. But as well, you can also have too much curve, and you can have not enough. So it's we see both in our office, and we see overcompensation. So like, if someone's mid back, like that turtle is like, think of the old man who has Parkinson's, unfortunately, right? They're hunched over. They can hardly look up, right? They're looking down at their feet because they're so rounded in their mid back, right? Their neck is going to be so far in the opposite direction to make up for that. So you see a lot of compensation as well. And it doesn't need to be that extreme to see it. But yeah, so that's just one angle that we look at for spinal health. There's other components to it, but I think just to clarify, like you said, that's just one way that we look at it from a backed up bird's eye view.
Cool. And so for people like outside of a chiropractic office, is there things that people could do at home with what they have around the house, with maybe that's corrective exercise, maybe that's like, the way that you're sitting, the type of exercise that you're doing to pull tension out of the body? Like, if you had to say, hey, gun to head, doc, you can only give someone 3 recommendations to improve their spinal health without seeing you, right?
Yeah.
If you never have the opportunity to see them again, what would you say?
So I'll do this. So I don't know if I can give you 3, because there's technically, I guess, 6 ways.
So 6, give me all 6.
So,
that's fine.
Yeah, perfect. So for the neck, let's say you need more curve in your neck, right? One thing that you can do is at home, right? And if you do this, right, just be aware that, just be mindful that if you feel dizzy with this at all, or get headaches from it, right, to just not do it or reduce it. So is lay in your bed on your back with your head, hanging off the bed, and just let it go into extension, right? So again, laying this out, you're on your back, right? You're on your bed, your head is hanging off the edge, and you're just going to let it drip down towards the floor, right? If that's too extreme for you, just roll up a towel, okay, into like a cylindrical shape, and then lay that behind your neck. That'll bring you into a little bit of extension. That's if you need curve. I don't think off the top of my head, I can't think of anybody who does not need curve or who needs to go into like flexion for their neck. I don't think anybody needs to spend too much time looking down. So I'll just say that you can either lay off the side of your bed on your back, or you can use a towel underneath your neck there. For your mid back, okay, if you find yourself in like you feel like you're hunched over like a ninja turtle, right? So one of the simplest things is just take that same towel, right? Cylindrical, roll it up, and then place that the long ways on your spine. So if my hand is my spine, right? Just lay the towel hot dog wise, like right on my spine, and you're going to lay on your back. Okay. And then your arms are out to the side. So you're just letting that towel push your mid back forward. Does that make sense, James?
Yeah. Yeah.
Okay.
I do that with the foam roller.
Yeah. Right.
And then kind of like goalpost my arms to open up my chest too. Same thing.
Yeah. 100%. Right. So if you don't have a foam roller, or if you do have a foam roller, use that. Right. If you don't, just roll up a towel, right? Or something that can get, into a position where it's long-wise, cylindrical, and lay it across your spine and have your arms out to the side. That'll just open up your chest, like you said. For the low back, right? Same thing as the neck. Okay. Just take a rolled up towel and place it underneath right above your butt. So if you feel your low back, you kind of feel like these bones that are kind of right around your tailbone area, right above your butt crack, okay, out to the sides a little bit. So place it a little bit higher than that. And so that'll increase your curve there. As far as if you need more curve in your mid back, because I've also seen that. Okay, if you need more curve, two things that you can do. One, wear a heavy backpack. I mean, as goofy as that kind of sounds, because I know like we give a lot of crap for kids wearing like super heavy backpacks and they round their backs, right? But if you're somebody who needs curve, do it. Right, do that. Or lay on that foam roller. This is gonna be kind of uncomfortable, but you can lay on that foam roller in the front. So you lay face down on the foam roller.
I've never done that. Does it suck?
I've never personally found myself doing that on purpose. It's not super comfortable. It's not super.
You've on accident been rolling piriformis or something else, rolled over, and you're like, "Whoa, I don't like this."
I found myself somehow like breastbone on the.
You like turned over, like, "Whoa, hands up! Whoa, what's happening?"
I mean, I would say first, just go hiking with a backpack, right? And strap it tight, right? Don't have it be sagging, because then you're going to get the opposite effect. Okay. Have it tight to your back, right? Put the belt loop on, put the chest, strap on, and then you'll naturally start to, crunch forward and start developing some muscles that kind of pull you forward. Or you can just join a gym and do a bunch of bench press. That'll probably get you rounded back, in no time. But those would be, I think that's 4, maybe 5, but those are some good ones to just do at home. Overall though, I mean, what I would say is if you don't want to do any of that, and I think that you should do some of those things, but if you don't want to do any of that, just move your spine. Like do neck circles, right? Do hip circles. Just bend and move your spine unweighted if you've never done this before, obviously, but just move your spine through space. Motion is going to be lotion. So the more you use it, the more fluids it's going to get in there, right? And you'll be surprised at I don't have any anecdotal cases of this, but every single book that I read as far as biomechanics just talks, static positions are great. Mobile positions are better. So if you just move, your body's going to be healthier. So, yes, at our office, we prescribe traction, which means that you're going to lay on certain positions with certain pads that are going to get your spine into position. And those things that I just laid out for you guys to do at home, you can do them if you find yourself, needing one of those things. But also move your spine, bend, twist, right? Reach up overhead. If you're sitting in your chair, get up, move, stretch, all that stuff. All that stuff's going to be good for your spine as well. So that's what I'll probably say to that for stuff to do at home.
That is funny as shit. Just move, guys. What's wrong with you? Move. No, I think that it's simple and it sounds silly. And to me, I'm laughing because I'm like, well, duh. Like,
right.
Duh, you need to move. Right. But I think that's a privilege to understand that and not even question it. So go ahead.
I was going to say, you'd mentioned a privilege. I think that we take that for granted, right? How many of us, including myself, right? It's, I don't really take advantage of, things that I can do when my back doesn't hurt until my back hurts. And I'm like, geez, I wish I could just bend over and like sit down on the toilet. Right. Until I, until I can't,
Yeah.
And so for it, like you said, it sounds simple. It sounds silly. It's like, oh, well, I can do that now. I don't need to practice it. When you get to a position, right? If you ever do where you're now missing movement or in pain and can't do that movement, you're going to be wishing that you had, doing that stuff beforehand. We all wish that we never got cavities, right? And we're all like, well, I'm going to floss. No, and I promise, until the dentist fixed our cavity. And then we're like, I'll wait till I'm good, right? Do your preparatory work while you can.
Yeah.
Before you ultimately maybe can't.
Yeah, fair enough. I think that's a lot of information. That's a lot of stuff for people to take in. Yeah. I think that we'll end that episode there. But overall, if I could sum it up in any few words, it would be more movement, right? Body weight. Do not take it for granted. And then number 2, check in with what your rotation looks like. How do you feel when you bend over and touch your toes? How do you feel when you reach back like you're in a yoga tree pose? How do you feel when you bend to the side, left and right? How do you feel when you go transverse, right? How do you feel doing these kind of things? If you step a lunge out and away, like diagonal from where you're standing right here, how do you feel? Most people don't feel great. Most people don't have any ability to control themselves in space going diagonally or side to side, right? Very weak. We're solid front back, sometimes up down if we're athletic. Not really left right, and not really any diagonals or rotation at all. 0.
Yep.
And so we need to do better about that. So we appreciate you all listening to this. This is obviously up every single Wednesday. We have not missed a Wednesday, and I couldn't tell you how long. And as long as neither of us dies, we won't. So we have an episode that comes out today when you're listening to this, and we'll have one every single Wednesday for eternity until we either get tired of each other or we die. So yeah, that's that. To end on a extremely morbid note, but I hope everyone is living well, and movement doesn't cost a damn thing. Doesn't cost a single dollar, and you can find anything that you want on the internet. So get to it.
Let's go.